So this is your case scenario, correct? 72 years old, posted for post CABG, posted for right inguinal hernia repair. This is the case scenario, correct, Muthu?
Yes, sir. Correct, sir.
Okay, so first you analyze the case. It's a short case scenario. So 72 years old patient, geriatric age group. So whatever changes that we have already seen are there. And patient is a known CABG done patient for ischemic heart disease. Herniorrhaphy may be a simple surgery done as a daycare procedure. And what information you need is age-related problems, any other comorbidities other than this ischemic heart disease or hypertension, the status of ischemic heart disease, medications and effort tolerance you need to know, hernia, whether it is reducible or irreducible, any previous obstruction history is there in the hernia, and any voiding difficulty or chronic cough as a cause of hernia. So patients sometimes, they may have a prostate through which he must have developed the hernia. So always ask for these two, because post-operatively sometimes the patient may not be able to void after hernia surgery, and you may have to put him on a catheter and do a TURP within a week or so. That's the sort of cases we have seen. So for all hernia cases, the surgeon should always examine the prostate and rule out an enlarged prostate. And coming to the pre-op and evaluation, general examination including airway, dentition, back and spine, and cardiac status, number of years since undergoing CABG, mainly to find out whether the graft patency is maintained or not, any recurrent angina, how is the effort intolerance, how antiplatelet continuation, and functional status of graft by echo or by thallium studies. And pre-op instructions, discontinuation of long-acting antiplatelet drugs, and if planned as a daycare, advise pre-op sedation at home previous night with alprazolam, NPO instructions, continuation of antihypertensive if any, and intra-op management, you can use central neuraxial blockade as a single shot spinal, epidural, combined spinal. So as far as possible in the exam, do not commit with hernia block straight away, because they may try to ask you all the details and get you into trouble. So stop with the central neuraxial blockade and epidural combined spinal. If they insist on any other regional technique, then you go for answering hernia block or ilioinguinal nerve block. And the ilioinguinal nerve block is mostly recommended as a post-operative pain relief rather than simple intraoperative analgesia alone. And GA, if patient refuses regional or if there is an infection or altered coagulation profile, always avoid hypoxia, hypotension, and specifically diastolic hypertension and tachycardia. And questions you have to expect is anatomy and control of coronary circulation. Suddenly, because this is a CABG case, they can jump to asking you all about anatomy of coronary circulation and acute coronary syndrome. That questions may be directed on that instead of asking about this management of hernia, like what are the types, clinical features, and management. And sometimes they may ask you about anesthesia for CABG also, and pathophysiology of coronary artery disease, ECG interpretation of myocardial infarction. They may suddenly ask you which are all the leads which will show LAD block or right coronary block, circumflex block, or they can ask you about lateral wall ischemia, anterior wall ischemia, which leads you look for, and drug therapy post CABG and their adjustment, methods of assessing effort tolerance, like the regular activity as well as cardiopulmonary exercise testing, and diagnosis and management of intraoperative MI. This is another important question in all coronary artery disease you must be aware of. Or sometimes the questions may be directed purely all about daycare anesthesia. So how do you make the patient selection? What are the criteria for admitting a patient as a daycare patient? What are the requirements? And how do you decide the discharge? So all those questions may be asked. So these are the 2 points that you can note down and keep